Hi everyone, we're now here live inside the treatment room of Cosmedics in BGC. I'm Dr. Gia Jorge, the dermatologist, and beside me is the pioneer of Hiko HD, and none other than Dr. Alvin Jorge. So now we will be doing the Hiko HD procedure in our patient. This is Jessa, a 27-year-old female who has been wanting to have non-surgical nose lifting because she's afraid to undergo surgery. And a few minutes ago, Dr. Alvin Jorge was able to do the first part of the Hiko HD procedure, which is the alar narrowing. So as you can see, even with just the first part, we could already appreciate improvement of her nose, of her ala. Okay, so now I give the floor to Dr. Jorge.
Hello, everyone. So I'd like to update you with what we've done. Earlier, we've actually done local infiltration of local anesthesia onto the bridge, the ala, and the columella of the nose. We've actually just finished putting some threads to improve the alar base. And as you can see, the ala is now narrowed. So we can now proceed with the tip projection. And we're going to put some short Hiko threads onto the columella. The columella is actually the one that's in between your nasal openings. Okay, so this is your columella. So now we're going to insert this thread. We have a very short thread here, and we're going to use it and insert it onto the columella, and this will help provide a better projection of the tip. I usually use around 2 to 3 Hiko short threads. As explained to you by Dr. Gia, Hiko literally means high nose. Ko is nose for Korean.
Okay, so Dr. Alvin, we have a question from our audience, from Jonah. She's asking if the procedure is painful. So maybe we can ask our patient, Jessa.
Oh, maybe Jessa can answer that question. So how are you doing, Jessa?
I'm very relaxed
All
right now.
Very relaxed.
Okay.
Very good. So are you feeling any pain at this point?
Wala totally.
Totally
Wala,
none, from
okay.
0 to 10, 10 being most painful,
Zero.
0. Okay,
Zero.
so
Very good.
I
So-
guess that answers your question, Jonah. It's not painful.
And if you have other questions, please don't hesitate to send your questions through FB Live, and we'll try to answer them live as well. So now I'm inserting the third Hiko short thread. So now you can probably see a better projection of the tip, but we're not yet done. We're still going to continue with the most awaited bridge augmentation. So maybe we can change Dr. Gia. So with the bridge augmentation, we're going to use a longer piece of thread, and this would be very similar to what we used earlier. It's just that the thread is longer. It has the same thickness, although it's just a little bit longer. Here we can see the thread. This is a longer thread compared to the short one that I showed you earlier. And we're going to insert this to augment the bridge area.
Okay, now, so Alvin, we have another question from Risi. She's asking, how long is the effect and how long does the Hiko procedure last?
How long is the effect and how long does it last?
Yes.
Okay. Well, the effect would last you for about one year up to 2 years, because as you may have known, the Hiko thread is absorbable and it does not last. But that's actually one of the advantage of doing this, because having a temporary material inside would also give you that safety that if you don't like it, it's just going to be absorbed later on. So this thread actually causes some tissue reaction so that it helps build a little bit of tissue reaction around the area. So even when the thread has dissolved, the tissue reaction that it created will extend the effect for a longer period of time. And thus the effect of 1 year to a maximum of 2 years.
So you mean to say, doctor, that if the effect is already diminished or almost gone in 2 years, can the patient do the procedure again?
Well, definitely. Well, for many patients, it's one of two things. It's either they would want to see how it would look on them if they had the nose lift, and this would be probably something like an in-between before doing surgery. And for some patients, they don't really want to have surgery. They don't want to take the risks that is accompanied with surgery, so they just have this done. And a lot of patients are actually happy with the results, and we just come back to have it done again and again.
Okay, that's good. That's good to know. So we have another question from Vanessa. She's asking if Hiko HD is safe. Is it a safe procedure?
Hello, Vanessa, and to answer your question, it's a definite yes. It's among the nose lifting procedures available. I do believe that this is the safest method, even compared to surgery and even compared to other non-surgical procedures such as filler injection. This would be the safest, I believe.
Okay.
So now we've actually inserted around 7 Hiko threads, the long ones, on the bridge area. And as you can see, there is a significant difference already. Now, normally I put around 6 to about 10 threads, but of course I do adjust depending on the nose of the patient. And usually, I show the nose to the patient and ask them if they're already happy, if they want to add more, if it's enough, it's too much, and then if it's enough already, then we stop. Okay, so probably we can show Jessa right now how it looks like. Maybe we can get a mirror and have Jessa take a look at her nose right now.
Yeah.
Okay, so maybe Jessa, you can take hold of the mirror on your right and take a look. Oh, oh why are you laughing?
Very nice.
Very nice.
Oh, very nice. Okay, so you need to take a look at the height also. Can you give her back the mirror? Yes, I need you to take a look at the bridge because this is one area that I need your help. So take a look, face a little to the side, and tell me if this is enough or if you want to add more.
I think it's enough already.
If it's enough, I usually tell patients that a little bit of swelling is caused by the anesthesia. And if you would want to have this effect, it would be nice if we could add a little more. So would that be okay with you? Okay. Okay. So
Okay, so
we have a very happy patient here.
Okay, that's good. We actually have another question.
Okay.
They're asking if the Hiko HD procedure is also applicable for young adults.
Young adults. Well, I usually the youngest age that I do this would be patients 18 and above.
Okay. Actually, some of our Korean patients have this as their 18th birthday gift.
That's right. Very true. More? So the number of threads really differs from patient to patient. Some patients already have nice noses, so they would want to sharpen it a little bit, and the Hiko is a really very nice procedure to do for this set of patients. So this is now my 9th thread on the bridge of the nose. Of course, you would have to design the nose depending on the shape of the face of the patient. So if the patient is a little bit on the rounded shape, then you want to balance it, not too sharp.
Okay, so how about for post-procedure instructions? What would you usually advise?
Okay, so very important for you to apply cold compress immediately after. The first 8 hours would be very, very crucial. This would minimize the amount of bruising and swelling that you get if you are very, very religious in applying cold compress. So 8 hours minimum to a maximum of 24 hours. After 24 hours, no use for cold compress.
Mhm.
How many have we inserted?
10.
Okay, so maybe we can take a look again. Can we give,
The mirror.
okay, just maybe you can take a look again.
Better and prettier.
Okay, oh, don't touch
Okay,
it, don't touch it.
yet.
Okay, so we usually get that kind of response. People usually smile, they laugh because they couldn't really believe. Exactly.
It looks very, very natural.
Even after the procedure, you just see that there's a very nice enhancement of the nose.
Dr. Alvin, we have another question from Lawrence. She's asking if how long is the downtime?
Well, downtime really depends on each patient, and some patients really bruise easily, some don't. On the average, it's probably a few days to a week. But the swelling is usually, majority of patients, quite minimal. You can actually go out the following day.
Okay. But how about the patients who drink and smoke? Do you advise them to stop for a few days or?
That would probably be a good idea because smoking and drinking affects healing.
Okay. Thank you.
So let's take a look.
Here, maybe you can sit up.
Right.
Maybe she can sit up to
Okay.
appreciate her nose better.
So here you would notice that there's a significant narrowing of the alar base. It's usually a problem among us Filipinos. And also the tip has been improved. There's better projection. The tip looks thinner and pointier probably. And then if you take a look at the sides, you would notice a very nice enhancement of the bridge of the nose, or the nasal dorsum as we call it. So if you make the patient look upwards, you would notice a very good difference or improvement with the shape of the nose of the patient. So it's a very natural effect, very nice procedure, no incisions, just punctures, and you get this kind of result. This is a live demonstration of the Hiko HD to give you height and definition of the nose in a non-surgical manner using threads. Thank you very much.